It's up to you. I mean, all I was going to suggest I'm just trying to think who it was, Juliet, I think it was, that asked a question about P4A, is that there are some really good resources from NDTI, which has the contract as part of the delivering better outcomes together. These acronyms are not great, are they?
Full marks, Tina, you got it.
Thank you. Especially when you're working with about 20 million of the things. But they have some really good resources, and you're right. We need that they do resources for both young people and parents. And being a parent carer forum representative, we do need to have those conversations with parents much earlier on than age 14 plus. And they are excellent at delivering training as well. Not that I'm saying that Philippa isn't, because she is, but they do have the specific contract for preparing for adulthood. So it might be worth looking at them.
They do, and we can direct things around between the providers and stuff. Right, now that we've got a good number of people in, I shall get started. Now, I thought I'd done something very clever that allowed me to both share my screen and see the chat, but I'm not sure I've 100% managed to get it to work. So I will go to what is known and comfortable, and Kate, if you could just shout out, call out if there are questions in the chat. There aren't very many of us, so we can be quite relaxed and informal about this. So please do jump in if you have questions as I go, rather than waiting till the end. But at the end, I will ask you, just as I've just been chatting to the others as we waited for people to join, if there are gaps that you think that we might be able to fill over the next year. So thank you for joining me this morning. For this just quick summary of what CDC has been working on in terms of e-learning over the last year or so. My name is Philippa Watts. I'm Senior Programmes Officer for the Health Team in CDC, but the bulk of my work is on the DBOT contract, which, as Tina says, stands for Delivering Better Outcomes Together, and is all about getting multi-agency working and communication around the SEND reforms up and running. I recognise many of your names, so a lot of us have worked together in the past. So I have some slides here, but as I say, do jump in with questions and so on and so forth as I go, and then we can have a bit of a discussion at the end. Right, so all of our, good start. All of our e-learning is freely available on our website. It is all self-guided, so you can sign up and access it whenever, wherever. Do it at 3 in the morning if you want to, though I wouldn't recommend it. Take it at your own pace, do a module here, a module there, or sit for a whole day and work through. It's flexible in that way. And when we say all, we do mean all. It is on the whole aimed at professionals, but there is absolutely nothing stopping parent carers from accessing it. In fact, I will talk about the modules that we do have specifically for parent carers as part of our expert parent programme as I go through. But the majority of them are aimed at professionals. There's also nothing stopping children and young people accessing it if they want to. As I say, they're not designed and they're quite nice. Sorry, we lost and lots of drag and drops. You've lost me.
We lost you for a bit, so we just missed a little bit.
Okay. All right. Where from? I'll just start again.
It was only a few seconds.
Okay. I won't go right back from the beginning then. And you will get the slides before anyone asks. You will get these, so you'll have that link. So don't worry about that. Yes, the majority are aimed at professionals, but anyone is welcome to use them. They're not designed for children and young people, but stopping them if they want to and they have that level of capacity. They are nice, bright, simple, broken down into true and false, multiple choice, drag and drop, that kind of thing as far as possible. So do please use them yourselves, spread them widely, share them with your colleagues, share them with the families you work with. They are open to all. I'll go through a little bit more about the sort of ways of using these modules as we go on, but there are different ways that you can think about them. So you can completely access them as an individual, just with your own learning and your own development, but we really encourage people to use them across their team, or even better, across their local area, to think about what is the impact of this learning, and how can we use it to change our systems, to shape our practice, to share a bit more. So throughout the learning, there are opportunities to reflect on that, that there might be sharing and learning between agencies and between colleagues around. We at the moment have an offer where local areas can access some of our e-learning en masse, and then invite us in to run a workshop around how do we use this knowledge and how do we use this understanding to work together and make progress. So that's something that we're offering at the moment. We are expecting to be able to offer something similar in the new contract year, which starts in April. So if any light bulbs go off during this presentation and you want to tap into that support, please do contact me and I can put you on. I basically have a waiting list for areas for next year's support. So we can start that conversation now if that's not a problem. For all of our modules, they don't come from nowhere. They come from sort of frequently asked questions, frequently raised issues, the sorts of things that we see echoing across the country as being common challenges. So we identify them through our wider work and then develop them mostly through the DBOT contract. But as I say, we've got the expert parent programme as well. So we find ways to answer and tackle those commonly experienced issues. We always start with user focus groups to think about the content. So we might do some sort of rough work initially, drawing together materials and resources that we already have, but we always have a discussion with a focus group of whoever that resource is aimed towards. So our health advice learning, for example, drew together DCOs, DMOs and health practitioners. Our expert parent ones always start with a group of parents who have lived experience of whatever that particular issue is. So we really start with that shared understanding and identifying what it is people want to know through the e-learning. And then we do a bit of drafting and we come back to them for their comments. So there is that co-productive element right at the beginning. And that's shown into them. It's been really positive. Yeah, it's a really nice way of working. We try and make them as interactive as possible. A lot of these sessions are things that we would do live, and in fact some of them we still do live. This is just a sort of alternative way of accessing that. So there's as much interactivity as we can, and we try and keep them lively with case studies and for reflection, as well as the sort of true and false, multiple choice, all that kind of stuff that you're used to with e-learning. We know that people flick through the slides if they can, so we build in those sort of pauses and that opportunity to reflect. They are quite enjoyable, I say so myself, but people are saying that they're enjoying doing them. And we try and keep them nice and small and bite-sized, so they're not too intimidating or too onerous.
Philippa, sorry, it's pausing.
What have we got? Our big package is, I'm not really sure what I can do about that, Kate. I haven't got anything I can close. I can go and plug into the, is everyone having this issue or?
Yes, yeah, it's breaking up.
I'm gonna take you on the road with me and I'll go and plug in directly into my router. Bear with me just one moment. I'll stop sharing just for a second. Oh, I'm taking on a tour of my house, so you don't need to see that. I seem to have problems when it's windy with internet. I'm now not going to put my camera back on as I'm in front of a freshly plastered wall, which is not very exciting, but hopefully that is better. Is that sounding better?
Yes, that sounds fine at the moment.
Great. Okay. So our holistic outcomes in EHCP package. This is the big one, and it's ever growing and ever developing. So I think a lot of you may be already aware that we have the core holistic outcomes in EHCPs series of modules. That's 6 modules. I will go through those quickly in a moment, and that is what is effectively our live workshop, be it face-to-face or online, condensed down into 6 modules of e-learning. So that's just translating what we would do in a face-to-face session into that digital format. That is already live, up and running. We've had a lot of people access it, a lot of excellent feedback on it, people saying that it really breaks down the process and how we really centre those outcomes around children and young people's preferences and wishes and aspirations. So you are welcome to dig into that as soon as you want to. And as I say, I'll share the link where all of our e-learning is kept. We are currently developing, and I'll go into these in more detail, but we're currently developing a supporting series of modules around health advice in particular. That's in development at the moment, which will support that core set of modules. And we have a social care set which sits alongside that health set. So we've got this sort of twin parallel programs there. We're currently working on some annual review modules. These are really, really exciting. I've had some really wonderful sessions with our children and young people's group, Flair, around these. It is what I'm going to be spending my afternoon on today. So those are in the pipeline and they should be available. All of these should be available by the end of March, those that aren't already. So they will be hot off the press, and keep an eye on CDC comms for details on the release of those. Throughout all of those, we focus on the legal requirements, all that sort of process stuff, roles and responsibilities. We know that these are complex processes, and the multi-agency nature of them makes it a tricky picture. So we really unpick, you know, from my perspective, what is my role in this? What is my responsibility in this? And that includes children and young people and parent carers as well. So we unpick those things to that level. We have examples of good practice. And we really stress the importance of child, young people and family voice. We know that it's completely central to getting this right. So we will bang that nail home as much as we can. And as I say, we've got input from our children, young people and parent carer focus groups running throughout. We like to use case studies. Some of them are real. Some of them we've written for these purposes with input from families. Because that's what brings it to life, and that's one of the things that we've heard that people really enjoy, is thinking about particular individuals through these processes. So we try and tie it into that real life experience as much as possible. And I've already mentioned that we encourage throughout these reflections on local area practice. So alongside the sort of interactivity on the e-learning themselves, the true and false and so on and so forth, there is an accompanying learning log, which you get signposted to frequently to reflect on and think about, what does this mean? What does this good practice mean for me and my learning? Is this what I'm seeing in my local area or not? What difference could we make to progress towards this? That kind of thing. So learners will also have a document that contains their reflections after the e-learning that they can take and discuss with teams, colleagues, and so on and so forth. So a little bit more detail about that core set of modules, the holistic outcomes and EHCPs. It is for anyone and everyone who is involved in that process. As I say, it looks at the process as a whole and how do different people's roles fit in with that. So if you have any contact with the EHCP process, do make use of it. We're finding that as well as these sort of core individuals who are listed here, people are using it more and more in getting awareness to those who are less frequently in contact with the EHCP process or just need an awareness of it. Youth offending teams, fostering, those kinds of people who wouldn't ordinarily access a live workshop because they wouldn't be prioritised. But because this is freely open and available, they're finding that those peripheral individuals are really benefiting from this. So do spread it far and wide, as I say. There are currently 6 modules. It will go down to 5 when our annual review in-depth stuff is up. There's an introduction. We focus on the importance of aspirations as the golden thread. Some really, really lovely examples from children and young people there. We look at outcomes from the child, young person and family perspective. And we have to start with this. I think this is so important. And this is certainly something that I've learned from our from our live workshops is that when you say to someone, you know, what is an outcome in an EHCP, they go, oh, outcomes are smart. And they've already jumped ahead a step and not thought about where do they start? How do they start from that child, young person and family needs and wants and preferences? So we take it right back to that beginning and starting with that person-centered conversation. So we start with that before we even think about what does this actually mean in terms of the EHCP process and how as professionals do we support that. So we really want to anchor it in that voice. And then there's a look at the legal considerations and the sort of timelines and all that kind of thing. There currently is a module there on annual reviews. It's quite brief, but as we know that annual reviews are something that people want to work on, we are developing, as I say, these additional modules that go into this in much more depth. So once we have those live, we will take that 6th module down and signpost people to these more in-depth modules. I mentioned a little bit of this already. We expect people to use it as individuals and across their teams. And as I say, we can support with some of those discussions. People are also telling us that they're using it in staff inductions. We know that there's a lot of change in staffing, that people are coming, going all the time. We hope this is a way that we can sort of embed this learning into organisational memory a little bit, because so much is lost when people leave. So hopefully this is a resource that you can use again and again as colleagues join. I've already mentioned this sort of wider awareness, and parent carers are also telling us that they're finding this very useful and that it's breaking down quite an intimidating process into some more bite-sized steps. I also hope that it's going to start raising expectations around the process, making sure that we are starting with that person-centered conversation. That's certainly what we hear from our live sessions, that is the big light bulb moment that people have, that, oh, it's not just the aspirations that come from the children and young people, it's the outcomes as well. So hopefully when we're all raising our expectations around that, we know it's a challenge to actually implement that and bring that to life, but hopefully this changes those expectations and changes those ways of working. So that's the sort of the big package. I will say it takes quite a long time. It's a whole day of live training condensed down into online sessions. Each module takes about half an hour, so you do need a good chunk of time set aside from that if you're going to use it. But as I say, it really is worthwhile, and we've had excellent feedback from users. So our quality health advice in EHCPs, which is going to sit alongside it, this can be accessed independently of the core module. You don't need to mandate people to do the core one and then follow it on with the health advice. But we do have recommendations in there that if you don't already have a decent understanding of person-centered outcomes, that you do go and do at least some of the modules of that initial core module set first. But this has been designed in response to requests from our focus group, that it's split into 3 levels. So the first level really is the basic sort of, what is an EHCP? What do we expect from it? What does one look like? How do they come together? That really initial awareness stuff. And we were asked to do that for those health practitioners who don't often give advice and might be called on just rarely, for example, diabetes nurses and those kinds of people who just need that very quick, very rough grasp so they can contribute meaningfully. Level 2 is a bit more digging into the good quality of advice and making sure that we really get into what good advice looks like. So thinking not just about a child's conditions, but actually what that means for them, what the impact of those conditions are, and how those needs manifest in relation to the outcomes, so that we make sure that when we're giving advice, it is driven towards achieving those outcomes and not just this kind of child needs this kind of support. So that unpicks some of those little bits a bit more. Level 3 is for our strategic colleagues, for those involved with quality assurance, and it looks more at the health advice process as a whole. So what the templates look like, how requests for advice go out, how they're coordinated when they're received, that side of things. And there's a little bit more detail about particular types of advice. So the difference between what advice around equipment looks like compared to advice around therapies or education and so on and so forth. So it unpicks some of those sort of process issues in a bit more detail. So this one isn't progressive. You don't have to do 1, 2, 3. It's about getting in at the right level and what is most useful for you. I won't go into this in great detail, but I'll just sort of give a gloss over. So that level 1 is, as I say, that real basic stuff and understanding that we are one part of this bigger process, and how we see the health professional in that process and what that role looks like, and how we recommend provision. As I say, you will get these slides so you can look at them again if you want to. Level 2 is more about that understanding advice as the bridge between needs and outcomes, as I've already said. We were also asked to think about the challenges and the sort of internal wrangling that health practitioners go through when they know they're being asked to be simple and accessible in their advice, but there's always that sort of the tribunal cloud hanging over their shoulders, and making sure that they're covering their themselves in that in case of that happening. So we look a little bit about the importance of simplicity and reassuring those practitioners that you know, that they don't need to go into lots of complex detail, lots of historical detail, lots of jargon to write good advice. There's also a little bit of a reflection about the role of the advice giver in the annual review. So just reminding ourselves that you don't just hand in your advice and that's the end of your journey with that child or young person. So we just have a bit of reflection on that wider role.
Philippa, there's just a comment from Juliet, just to say that it would be good to link in with the competency framework development work.
Yes, definitely.
As they're looking at levels 1 to 5 competency. Absolutely.
We should probably catch up, Juliet. I'm doing a piece of work with another local area about developing their competency framework, so it would be good to I missed your talk, but I will catch up on it in the recordings. But yes, let's catch up and see how this might slot in. The level 3 content I think I've sort of already covered. It's about that coordination and that process and the importance of multi-agency planning. The quality assurance stuff is interesting. The conversations that I've been having with local areas really are telling me that people are really wanting to look at quality assurance in terms of quality and not just that sort of timeliness aspect of things. So digging down into what does quality advice look like and how do we embed that into our quality assurance. So that element there. So that's the healthcare advice side of things. And as I say, we also have this social care element, which is similar in ways and different in others. This has been developed by our colleagues in the social care team. So I apologise if I can't answer any questions with much detail, but I can pass you on to someone who can. These have just been bullet points passed on to me. So again, what's the audience for this? We're looking at social work teams really quite broadly. I could go down that list, but I think the last bullet point there sums it up. It's sort of anyone involved in giving social care advice. And of course, we know that it isn't just statutory social workers who are entitled and eligible to give their advice in the EHCPs. It could be anyone, brownie leaders, I don't know, swimming coaches, anyone in that child's broader life who might have something to bear on those EHCPs. There are 2 modules in this. The first is quite a broad one, looking at the role of social care within the SEND system. So that's quite similar to the sort of the first level one in the health advice. What is that wider framework? How does social care fit in with that? And some of the resources available to that. So this goes a little bit more broadly than EHCPs, but it's useful for those who sort of want to cite themselves within the SEND system. And then module 2 is more about the specifics on information sharing and consent. We know people struggle with H1 and H2 sections, what goes where, so that it helps break that down, thinking about what goes in the different sections. And it reinforces that point that we're making throughout all of this e-learning about the relationship between aspirations, outcomes and advice, and that advice isn't separate to or parallel to those other elements, but it's crucial in joining all of that up with the golden thread. As I say, this one is live and ready to go. This one could be accessed, but the health one is still in play. I think that's just having final touches, the health one, so that should be with us in the next week or so, I'd hope. Annual reviews. This is the one that I'm still working on. It's still very much in development, but a really exciting one. This again breaks down the annual review process from those different perspectives. This one has a bit more of a an emphasis on the parent carer element. So I think this is one that I think we really should be sharing with our parent carers. And I'm looking at you, Tina. I can't see you, but I'm looking at you and your colleagues to help get this one out. We know that annual reviews are something that are not working well for everyone yet. I had a focus group with the FLARE group, our Disabled Children and Young People's group, and heard some really quite difficult things. And we haven't shied away in this e-learning from sharing some of those quite upsetting, I'll be honest, quite upsetting experiences of annual reviews. And they've told us they really want to be positive about this. They want these to be empowering and exciting and helping them to look towards their future. And so often that isn't the case. And I've also had conversations with parent carers who are underwhelmed by their annual reviews or confused by their annual reviews. And we really want to use this e-learning to break down some of that anxiety and really clarify what the annual review is for. So again, this is for everyone and anyone involved in annual reviews. It's not just the annual review meeting, it's the broader process and the sort of the role of the meeting within that. We have 4 modules, or I should say we are developing this with our colleagues in NDTI who are going to be doing the preparing for adulthood side of things. So all partners in the DBOT consortium plus representatives from local authorities and professionals and parent carers have been and children and young people have been involved in this development. So this is a really, really nice co-produced piece of work. The first module looks at the importance of the annual review from different perspectives. So what do children and young people want from their annual review? What do parent carers want from the annual review? What is it for the local authority and what is it for practitioners? So again, it breaks it down so we understand ourselves in that bigger context and not just sort of the business as usual. The second module is the more technical stuff, the requirements of the process, the timelines, all that sort of thing. The third one is the one that really excites me. This is what we know a good annual review looks like. So really thinking about that person-centered planning meeting and that sort of structure. How do we meaningfully involve our families? How do we get the child, young person and family voice really central to this, whether or not the child or young person wants to attend their annual review meeting? So we're looking at what resources and tools and adaptations we can make to make those really child and young person centered. How can we support them if they don't want to attend their meeting, but that really get their voice in, including those who are non-verbal or have low literacy. So I'm really enjoying this writing this section. My background is in children and young people's participation, particularly those who are non-verbal. So I'm really loving this. Year 9 additional considerations. This is the module that NDTI are developing, thinking about that preparing for adulthood. But I will say that we run the importance of preparing for adulthood through all of this. We don't want to put people off going, oh, well, that's not my responsibility. We are stressing the importance of preparing for the very earliest years throughout these modules. So it's not a bolt-on by any means, it runs throughout. So these, as I say, I'm working on over the next week or so, and then they'll go for comments and design, but we are really, really hoping to get them up by the end of March. So watch this space, but they're on their way. Before I go on to the, it's one. Oh, blimey. Expert parent. I won't ask for questions then. Expert parent program. This is our expert parent program led by our parent carer associates. All of these modules have been developed again in that same process with that parent carer advisory group and key issues identified by those parent carers. And this is all about breaking down the fear factor and signposting to further information. These have been developed in funded programs, but also these are sort of the sustainability element, that long-term resources. So these are available on our website as well. At the moment, we have a number of them. We have just moved over to a new e-learning platform, and not all of the expert parent modules have been moved over yet. That's a work in progress. But the ones that we currently have access to are new ones, which are through our Together for Short Lives contract, which has just come to an end. They are planning for an uncertain future, which is what we've termed sort of parallel planning. To make it a little bit less scary. So thinking about what happens if my child's health deteriorates. And what happens if my child, blossoms and develops and goes on to live a full, happy life. So that breaks down some of that concern and worry around that. And this second one from this Together for Short Lives funded programme is around supported decision making and the Mental Capacity Act. We know mental capacity is something that parents find really quite intimidating and actually quite scary. So again, we're just breaking it down to see it in a more positive light, and what is the parent carer's role and responsibility in supporting that decision making, and making sure that they don't feel that they're being left out, being losing their say in their child's life when that Mental Capacity Act kicks in. So breaking down some of that. We also have some around CAMS and mental health services. We have one specifically for the National Deaf Children's Society, and we have our generic one. So all of these modules are about parents who have been through the system with their child or young person, helping other parents to navigate the system, make the most and the best out of all their contacts that they have with professionals. How do you talk about your child in a way that is positive but gets you access to the services that you need? How can you be proactive and confident in accessing those services and communicating with professionals so that you're getting the support and the responses in an appropriate and timely way? So this is about, all of these are about building parental confidence. And as I say, we've got the generic one, but we've also got these modules that are sort of for specific cohorts of children and the specific challenges that they face when accessing the system. So the ones that are ready, again, are freely available. Please do share them, but we are updating them as we go, and we hope to get that done within the next month or so. It's a wonderful program. I will send you all more details about our expert parent program. We are still running live workshops online. Our parent carers are active on Zoom, so we will get you more information about these, but these are just the e-learning modules that are available. I realise it is 1 minute past 1. I'd said I wouldn't manage to get a full talk out of this one, but it's happened. So I'd really love to hear from you very quickly, if you don't have to disappear off. Any reflections or sort of things that you think, oh, we definitely should work on some e-learning on this issue? And do feel free to unmute if you want to. Hi, Natalie.
Hiya. I'm new in post as a disco in West Sussex, and have been doing quite a bit of this training over the last couple of weeks. Just seeing what there's out there. I think in our area there's a mass hole in training, anything to do with SEND actually.
You're not the
and
first
really
person to say that to me.
So yeah, that's on my agenda really, to improve that. So I'd be open arms to any support really, to help take that further. Also, I've done the module around the social care, and I think more examples of good examples, because there are lots on there, but actually seeing like proper live examples I think would be really helpful.
Mm-hmm.
You know, obviously they'd have the child's name need to be taken out. I don't think people who don't use the form very often would be able to fit those pieces of information in.
Thanks, Natalie, that's helpful. I'll make a note of that.
But yeah, any input into West Sussex around training would be amazing.
Noted.
Thank you.
Philippa, I just wanted to say thank you for keep mentioning parent carers and parent care forums. I lost count of how many times you mentioned us, so that's gratefully received. Going back to your point though about annual reviews, you know, we've just had training in all the regions, and the things that have come back is the confusion around the time element of when to do a annual review, especially when the time difference between when you issue and when you have the review,
yes,
is a common theme. And the other thing is about outcomes as well. So I know CDC have done some training around outcomes, but certainly, you know, the amount of local authorities that don't amend plans when outcomes have changed because the provision is the same, so the actual placement is the same, is also proving quite tricky.
Noted. Okay, that's great. I can stress both of those. Got a couple of comments in the chat. So thank you. That's nice. Any other questions or suggestions? Juliet saying, interested that others from social care other than social care can contribute. I've been involved for years, never realised this or seen this in any plan. Absolutely, we welcome and encourage. I'm getting nods from Natalie and Tina there. Yes.
And if you ask one of the judges in tribunal, they will say that social care needs to be more involved. And if you have on a plan not known to social care, you are going to be in for the high jump when it comes to tribunal judges.
Absolutely. We always say in our training, we all have social care needs. All of us on this call have them. We can meet them by joining a Zoom quiz, joining a football team, going to the pub, whatever. Our children and young people need a little bit more support to do that kind of thing. So making sure we're always having consideration of that. Juliet said, might be worth raising awareness in the health professional one, as they might know of participation groups that are accessed. Thanks, Juliet. That's helpful as well. Natalie, did you have another comment?
Yeah, I was just really interested. Obviously, my focus as Disco is really looking at the social care element side of it. But I was interested how the aspirations of the children were included, you know, how that was being done. Because from what I can see, there's lots of gathering of information, and that first part's written. But have also seen, obviously, with children that are non-verbal, they may comment on that. And it's like, actually, children can tell you without having to verbally say it. So, you know, who's doing those observations, etc.
Yeah, it's a common challenge. In fact, it's the thing that comes up whenever I do training on EHCPs. People ask, how do we get those voices of those who are non-verbal or low literacy or whatever, very complex needs? People are worried about it. People find it a little bit scary. And there's lots out there. So we're including lots of resources on that as well, and making sure that the professionals who are giving advice have those before they submit their advice is so crucial to making sure we've got that golden thread in the plan.
Lovely, thank you.
No problem. All right, everyone. Well, if there are no further comments, questions or suggestions, I'll just pop my email in the chat as well, because I am always interested in hearing from suggestions. So if you do think of things, if you leave this meeting and think, oh no, actually this is a common issue or something that comes up a lot, please do let me know. We are going to be planning much more of this over the next year, so I'm very happy to receive your suggestions. So thank you very much for your time. I hope you found the whole of this morning useful, and this session as well. As Kate said, please don't forget to fill in the evaluation survey, and we will be sharing information for all of the other sessions that have been recorded that you missed because you were attending this one. So you'll have access to all of those as well. Thank you very much. Again, enjoy the rest of your day and your weekends.
Thanks,
Philippa.
No problem.
Bye.